Hello everyone, welcome to my channel for nursing exams learning. Let us start with our today's question. The nurse is performing the initial assessment of a newborn. Which findings should the nurse report to the healthcare provider? So, the nurse is doing the initial assessment of a newborn. While she is doing, she finds something. So, what she will do? Definitely she should inform to the healthcare provider. So, out of these four options given, something is, as I am already every time saying, like unusual or unexpected finding or something like a serious complication. So the nurse should immediately inform to the healthcare provider. We'll see the options. Option 1 says a sudden jarring of the client's crib does not produce a Moro reflex. Option 2, the client has swollen labia and a thin white vaginal discharge. Option 3, the posterior fontanelle is triangular and smaller than the anterior fontanelle. Option 4, there are pearly white pinpoint papules on the client's face and nose. So when you read these options, out of this, which all are you find it's some of the normal expected findings. If you found something, directly you can eliminate those options because that one no need to inform to the healthcare provider or something that is not require immediate intervention. And we will discuss with the one by one. The first one is sudden jarring of the client's crib that does not produce a Moro reflex. What is a Moro reflex? That should be in the client with the first in the client, and that should be there with the 3 to 6 months of life. So a primitive newborn reflexes had to determine the client's neurological status and development. The Moro reflex, or we call that startle reflex, that present until age 3 to 6 months, how it is elicited? By quickly lowering the infant head relative to the body, like simulating a falling sensation. So while we are doing in such a way, how the baby or neonate will respond? The neonate will extend and raise the arms with the fingers fanned out and curls into a fetal position. This also can be elicited by sudden loud noise and jarring of the crib. If we are eliciting by any of these options, if it is a normal, if the Moro reflex is present, how the client will respond? The newborn will extend and raise the arms with fingers fanned out and then curls into a fetal position. In the picture you can see how it is performing and how the newborn is responding when the Moro reflex is normal. Absence of a Moro reflex may indicate there is an underdeveloped or a damaged brain and spinal cord, or there is some problem with the neurological status. So while the option 1 says a sudden jarring of the client crib does not produce a Moro reflex, that means the child has some problem or underdeveloped or a damage to the brain and spinal cord. That's why the child is not producing the Moro reflex. So this is something serious. The nurse should inform to the doctor. So our answer is option 1. Now we will just see why we didn't choose other options, or why other options are not the correct answers. The option 2 says the client has a swollen labia and a thin white vaginal discharge. What do you think? This is an expected finding for the first few weeks of life, and most of the time it may be probably related to the effect of maternal hormones. This will usually subside spontaneously, so that is not something unusual. This is an expected finding. Then the another option here says that the posterior fontanelle is triangular and smaller than anterior fontanelle. Yeah, that is a correct statement. There is no problem if we will see such finding. The posterior fontanelle that is located between the sagittal and labroid sutures, and that is triangular in shape. and it is smaller, and the anterior fontanelle is diamond in shape, and that is located between the frontal and parietal sutures. So that is a correct statement. There is no problem with the child. The child is normal. Then the option 4 says there are pearly white pinpoint papules on the client face and nose. What do you think? What is that? Yeah, this pinpoint papules, that we call it as milia. That is usually caused by the sebaceous materials in the follicles. These are normal findings and will disappear spontaneously within the first few months of life. So option 3, option 2, option 4. These are the expected finding and the normal finding that we will see while we are doing an initial assessment on a newborn baby or on a neonate. That's why we didn't inform the healthcare provider. That's why it's not our answer. So our answer is option 1. I hope you are clear why other options are wrong and why option 1 is correct. It is very important. We should study all the reflexes and grasping reflexes, everything, because the questions might be related to certain reflexes or some of the problem related to the neurological conditions. We know that there are some important conditions like spina bifida occulta. There are different types of that. So please study well and do well for your exams. Bye for now.